Alright guys, I know you guys are nervous and scared, and I really feel that social media has increased our collective anxiety, but the only way to stop fear is through knowledge. So here it is, COVID-19 made simple. What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor. And I'm here to break down health in a simple way. Now do me a favor, hit up that like and share button, especially that share button, because we need to get the word out about COVID-19. So let's get it started. Coronavirus is a large family of viruses that cause illness in humans and many animals. COVID-19 is the official name given to the disease that is caused by this new strain of coronavirus. Now, COVID-19 actually stands for, the CO stands for corona, the VI stands for virus, the D stands for disease, and the 19 stands for 2019, the year which it was first detected. The coronavirus is thought to have started in a meat market in Wuhan, China. See, in that meat market, they had many animals for sale. And the direct reservoir of this virus is thought to be bats. Now, how the virus went from bats to humans is unknown. Did it go through other animals first? On March 11th, the World Health Organization officially declared COVID-19 a pandemic, which means it spread over a large area. In this case, the entire world. It's now spread to over 100 countries, with the hardest hit being China, Italy, and Iran. And it's also in all 50 states in the United States. As far as the symptoms, they usually develop 2 to 14 days after exposure. That's why they tell you to quarantine yourself for about 14 days if you're exposed. And the symptoms themselves, they include fever, cough, sore throat, and shortness of breath. Now, as far as the severity of those symptoms, 81% of the people that get it, it's mild. Okay, 81% it's mild. Now, 14% develop severe disease where they develop some shortness of breath, and 5% develop critical disease where they wind up in the ICU with some organ failure. Now, as far as mortality and death, 2.3% of the people that get it can die. Now, typically, those cases happen in the elderly or people with other chronic illnesses like heart disease, kidney disease, lung disease, or some types of cancer. So it's crucial that for those who are most susceptible, they need to avoid crowds as much as possible. Due to the fact that testing is still limited, not everyone should get tested. Those that should get tested are the ones that definitely have symptoms, but they have to have on top of that and or close contact with a COVID-19 patient and or travel to a high-risk area and or are a healthcare worker. The virus is spread mainly from person to person, from those people that are in close contact with each other. And the mode of transmission is usually through respiratory droplets. Respiratory droplets are essentially the mist that come out when you cough or sneeze. Currently, there are no vaccines available, but they are working on them, but that may be months away. Currently, there's no FDA-approved medication for COVID-19. Treatment is mostly supportive, meaning rest, fluids, fever control, and for severe cases, they can support organs through ventilators and in the ICU. But there are areas around the world where they have tested antiviral medications with some success. So you've heard of social distancing. Since COVID-19 is highly contagious, the best way to prevent contracting it is by avoiding contact with other people. So it's best to avoid public spaces, large social gatherings, events, and large crowds. The CDC now recommends you avoid groups of greater than 50 people. The best way to protect yourself is to wash your hands thoroughly. In between your fingers, back of your hands, on your palms, for at least 20 seconds. Now, if soap and water are not available, then you can switch to a hand sanitizer, but make sure it has at least 60% alcohol. Also, avoid touching your eyes, nose, and face. If you happen to sneeze or cough, do it in a tissue and throw that tissue out. And stay out of close contact, at least 6 feet from a sick person. As far as face masks, if you are sick, it's best you wear the mask to prevent it from getting to other people. And perhaps if you're a caregiver of a sick person at COVID-19, perhaps you should wear a mask. Other than that, reserve face masks for healthcare workers, as there's a severe shortage of them now. If you found this video helpful, please like and share it to get the word out about COVID-19. And if you got something to say or got comments, put them in the comment section below. And remember, it's your kidneys, your health.